Good morning, everybody. Can I again thank nearly 63,000 people that came forward to get testing, and I really want to say a big thank you to those living in the Fairfield local government area. We have noticed a significant increase in testing in that community, and today in particular we want to encourage people living in the Canterbury-Bankstown local government area to please come forward and get tested, and also those living around Hurstville and Cogra in particular. And Dr. Kerry Chant will specifically read out a list of suburbs where we do want people to come forward and get testing. The good news is we're picking up extra cases, not just with those who have symptoms, but through the testing we're doing of people working and going out of the area has picked up a number of cases for people who aren't symptomatic. And that is a really important message. If you're living in a community that has a lot of cases, even if you don't have symptoms, don't assume you don't have the virus. Because in communities where the virus is lurking, where the virus is circulating, you could have the virus, not know it, and unfortunately take it home and give it to your loved ones. We don't want to see that distress caused in families and your closest people. So please make sure that you listen to our messages regarding testing. Thank you to those of you who have been. It's been outstanding, and we really need to keep up that effort. To the 24 hours to 8 p.m. last night, we had 78 cases of community transmission. So it's always pleasing when you see a drop in those numbers, but we still had about 27 people who are infectious in the community out of those cases, and that's the number we really want to bring down. Again, the main place where people are unfortunately either getting the virus or giving the virus is in workplaces. And that's why we had to take some of those difficult decisions we had to. We're still seeing a number of cases coming all across Greater Sydney, not just in those 3 LGAs that we've highlighted. But then unfortunately people unknowingly might get the virus and then take it home to their families. And if you have a large family in the household, because of how contagious this virus is, it really means everybody in that household is going to get it. And what we're also seeing is younger people getting it because of that phenomena. And I just want to really stress to people, all of us have to be on our guard. We know there are various venues of concern all throughout Greater Sydney, but in particular those 3 local government areas are still representing more than 2/3 of all the cases, and that's why the focus remains in those communities. Can I also please give a shout out to everybody working in Service New South Wales. Yesterday, whilst the system had some challenges in the morning, by the end of the day, nearly 6,000 businesses had their applications processed for support. And my message here is, please do not undergo any additional stress to what you're already going through. There is assistance for businesses. Go to Service New South Wales, and if you're an individual worker who wants that help and that support, please go to Services Australia. We're making sure that on the Services New South Wales website all that information is available. You can ring up and get information. You can still go into a Service New South Wales centre as well, although we're trying to reduce mobility and we do prefer people to ring or check up online. But if you must go in, you can, but make sure you're COVID safe. And we just want to encourage everybody to make sure they're aware of what assistance they can have and what support they can have to support them during this time. Now, I'm convinced that if all of us work together and focus on those key areas that are of concern, namely workplaces and households where the transmission is happening or the virus is spreading, we will get through this. And I just want to stress to everybody, no matter what you do and where you live, if you must go to work, please make sure you think about your situation. Have you been tested? If you have symptoms, you shouldn't be going to work. And if you don't have symptoms and you live in the Fairfield area in particular, make sure you get tested every 3 days before you go to work. That is really providing enormous benefits to us in capturing cases which otherwise may have been undetected, and we're very, very grateful that that's occurring. But all of us have to focus on workplaces and our households. That's the 2 main areas of concern and why the government had to take those additional difficult decisions last week. And we are hoping that by the end of this week, we certainly see the benefit of those more difficult decisions. But I do want to stress that the government is also working very hard with our communities to make sure people can go back to work safely after July 30, and we will be having more to say about that in the coming days. But in the meantime, thank you everybody for your efforts. It is making a difference. That 78 number would have been much, much higher had people not been doing the right thing. and we just need everybody to stick with it, to make sure that you protect you and your family and your work colleagues in particular. And please know that from tomorrow there are harsh penalties in place for employers forcing their employees into the work sites unless they're absolutely necessary. And that's really an important tool for us to make sure that employees aren't forced out of their homes if they can safely do their work from home. Dr. Chant will now give an update, and then Deputy Commissioner Warboys, and then we'll take any questions. Thank you.
Thank you, Pamela. So New South Wales recorded 78 locally acquired cases of COVID in the 24 hours to 8 p.m. last night, and one new case was acquired overseas in the 24 hours to 8 p.m. last night. Tragically, there has been a death of a woman in her 50s who was confirmed COVID case. She was a resident in southwestern Sydney and a close contact of a COVID-19 case, and can I just extend my sympathies to her, her family and her friends at this most difficult time. I think this now leads me to my segue to the fact that COVID is a very serious disease. We are seeing more hospitalisations, more admissions to ICU, more people on ventilators. We have to stop the spread of COVID. To do this, we all need to work together. We need to limit our movements. We need to consider whenever we leave our house that anyone with us, anyone we come into contact with, could convey the virus. So, whilst it is in human nature to engage in conversation with others, to be friendly, unfortunately, this is not the time to do that. So even if you run into your next door neighbour in the shopping centre, in the Coles, whilst you're at Coles or Woolworths or Aldi or any other grocery shop, don't start up a conversation. Now is the time for minimising your interactions with others. Even if you've got a mask, do not think that affords total protection. We want to be absolutely sure that as we go about our daily lives, we do not come into contact with anyone else that would pose a risk. Obviously, there are essential work. There is work, and I shouldn't use that term essential. I understand that work is essential to everyone, and probably we need a new word other than essential. But I think the community understands what we mean. We need to maintain our food services, logistics supply. We need hospitals and health services to be operating. But now is the time to really ensure that everyone complies with the spirit and intent. And the spirit and intent of the public health orders is to reduce mobility, reduce the opportunities for anyone to come into contact with anyone else. And so that responsibility is now firmly on workplaces to take those actions, and clearly we have seen the closure of a number of workplaces which facilitates that as well. There are some areas of increased concern. So in terms of my assessment of the situation at the moment, is we still see cases in the Fairfield local government area, and can I just thank that community. I had the opportunity to review the testing numbers today, and that community has responded, so thank you. But unfortunately, we have to continue to sustain those high testing rates in that community and continue to practice those COVID-safe behaviours of staying at home, not visiting friends and family. I am concerned about the emerging risk in Canterbury Bankstown local government area, so that covers Belmore, Lakemba, Punchbowl and Yagoona. And my reason is that there are a number of cases there, and there's also a number of exposure sites in that area. Also, I can confirm today that one new case was linked to the Al Sultan Butchery in Lakemba, and it's included in today's numbers. So again, please be aware if you've been to that butcher, the Al Sultan Butchery, please make sure that you follow the public health advice, urgently get tested and isolate, as well as your household members. The other areas that we have seen cases demonstrating we've got missing links. So we're finding unlinked cases in other areas, and that means that there's chains of transmission we're yet to crack and yet to break. That engenders quite significant concern to me. So also areas around Hurstville and Cogra, Marylands, Greystanes, Auburn, Guildford, Mount Druitt and Rooty Hill. I would also like to update you on the data in relation to the testing capacity. It has been pleasing to see those high rates of testing sustained, and we are working with the private pathology to ensure that those turnaround times and the throughput are maintained. And finally, another action I want to make it clear is permitted under these lockdown provisions is going out and getting a vaccine. You shouldn't go if you're a close contact or you've been designated as a casual contact, but please go and get vaccinated. There is access to vaccines, and the vaccines are incredibly effective at preventing hospitalisation and death, and they are the way out. And yes, we haven't got enough vaccine at the moment, but we have got some vaccine which is accessible, and I would urge everyone to go forward for your second dose of AstraZeneca, or also your first dose, or if you're eligible for Pfizer, to take up that opportunity. Thank you.
Thanks, Kerry. I just want to stress the message in regard to vaccinations. Clearly, we continue to see in the public arena messages coming out from some people who would describe themselves as anti-vaxxers, and others who have, for various reasons, opposition to vaccination. Can I just stress that anti-vaxxers obviously live in another universe, and others who give messages that this virus isn't dangerous and don't get vaccinated clearly have no medical or scientific training. This virus is an extremely transmissible virus. It can kill you, and it can kill your family and your friends. We've just heard from Dr. Chant that the number of people now going into our hospitals in New South Wales are increasing. The number of people going into our intensive care units are increasing, and the number of people being ventilated are increasing. And sadly, so are the deaths. So my message is very strongly that to the community more broadly, there is only one solution here, and that is to get vaccinated. Dismiss the ideas that aren't based in science or medicine or are propagated by anti-vaxxers who live in another universe. Book yourself in for a vaccination. We have quite a large number of vaccination sites now available through the state health system, but we also have GPs who are providing vaccines. We've talked many times about the fact that obviously there are some limits on the amount of vaccine coming through from the federal government at the moment, but they are trying hard to get more vaccine. What we do know is that they have now brought online more GPs to be able to distribute the vaccine. That means that you have the capacity to hopefully ring a GP in your area, preferably your own GP. If your GP is not vaccinating for whatever reason, ask your GP for a referral and advice to go to another GP in the local area and get your vaccine. There is no question that we will not get out of this pandemic without a very substantial proportion of our population being vaccinated. So please go and get vaccinated. Don't listen to some of these crazy messages that are coming out implying that this is not a dangerous virus. It's extremely dangerous.
Thank you, Minister. Good morning, Premier. Dr. Chant. 160 penalty infringement notices issued in the last 24 hours, and be rest assured that these notices are issued to people who have absolutely no regard for the health orders or safety in the public space. A couple of examples are a group of people who were spoken to at George Street in an office suite. Police were walking along. They found a gentleman outside of that, a young man. He took him into an office suite where clearly there had been a party with 6 other people, 7 people in a small office suite, birthday cake, alcoholic drinks, birthday food, and a person passed out on the floor. No evidence of any mask wearing, no good reason to be in that office suite, no good reason to have a party. 7 infringement notices issued and those people directed back to their residences where they actually live. A really, really good example, again, of where Crime Stoppers, New South Wales Police will take action where people clearly breach public health orders. Another example was a man that went into Bondi Police Station with a fairly frivolous excuse to be there. He was directed to return to his home in Marylands. He chose to stand outside then and wait for a lift, which apparently never arrived. Police again asked him to move back to Marylands, more than 30 kilometres away. That person was then later found on the gym equipment down at Bondi, where he ran from police. Police grabbed that man, spoke to him and issued him with a penalty notice for $1,000 for breaching the public health order. Just two examples of the 160 notices that are issued that should send a very clear message to people that whilst New South Wales Police will always work with people around public safety, around their own safety, that every single day we find people that clearly want to step outside the orders for very selfish reasons, and they put the safety of themselves, the public, at great risk. The other thing that I'd like to highlight today, that we've opened our Regional Emergency Operations Centre at Bass Hill. This is a centre that has government, non-government people in that centre in one space, under one roof, to assist and support the people of South West Sydney, in particular Fairfield. So that has a strong presence with local government and feeds back into state government and Crisis Policy Committee, where we can get the very simplest and easiest of problems sorted at the lowest level. Thank you.
Dr. Chan, are you aware in some instances that it's taking up to 5 days for people to get their test results? And why is it taking so long? Are staff fatigued? Are there not enough staff? What is the current situation?
Look, I want to reassure the community that one of